Welcome back. The South African Health Products Regulatory Authority says fake medicines are on the most dangerous threats facing the country's healthcare system. Authority CEO Boitumelo Semete-Makokotlela was speaking at the launch of the National Action Plan at the OR Tambo Protea Hotel east of Johannesburg. The launch, a collaboration with the National Health Department and the World Health Organization, pilots a plan to combat substandard and falsified medical products. Semete-Makokotlela says deadly products often contain undeclared toxic substances or the wrong ingredients. And to take this discussion further, let's now welcome SAHPRA CEO, Dr. Boitumelo Semete-Makokotlela, joining us via video link. A very good morning to you, Dr. Makokotlela. Thanks for joining us. Welcome.
Good morning. Thank you for having me.
Indeed, thank you. Now, you've described fake medicines as one of the most dangerous threats facing South Africa's healthcare systems. Just how serious and widespread is this problem currently, and what trends are most concerning to SAHPRA?
Thank you. This is certainly a serious problem for us as a regulator. We're sitting in a situation where a week does not go by where the public does not notify us of any substandard or falsified products, or we don't even block these products at the boards of entry. So we are seeing an increase in these products. And the big risk about them is that these can be deadly. We have seen in other countries like the Gambia, where children died after consuming a substandard cough syrup. So it is important that we tackle this problem as a regulator. In terms of the trends that we're seeing an increase, particularly since COVID. We're seeing an increase of these substandard and falsified products, but we are working, as you rightly said, with a range of stakeholders, including industry, to address this.
Now, Dr. Makokotlela, when we talk about the substandard and falsified medical products, what exactly are we referring to? I mean, are we talking about the counterfeit drugs only, or also the legal products, but that fail to meet proper quality and safety standards?
Thank you. And so hence we use these two terms, because what substandard means is that this is a registered product. It should be on the market. However, it fails quality requirements. So if we take a cough syrup, for example, if you see as a member of a public a cough syrup that has particulates, it means that it does not comply with quality standards. If you have a pill, for example, that when you touch it, it just frizzles. It shouldn't do so. So that is substandard. So these are registered products, but they don't meet quality standards. Falsified means someone is putting in the market a fake, say, grandpa, for example, when we know that grandpa is a registered product with the various manufacturers. So someone has falsified that product. And usually you see it with the quality of the packaging and just the quality of the product itself. So these are fake medicines.
And why do you believe the issue has become so prevalent now? Is it a result of increased demand? Is it a result of perhaps weak regulation at certain points in the supply chain, or more sophisticated criminal networks?
I think it's a myriad of issues. I mean, certainly one that we have noted when we engage with the public and a range of stakeholders is around the issue of access. That because of the tough economic times, you know, if people can get their medicine cheaper, they would rather do so than go according to them and pay a premium. So our socioeconomic context is certainly affecting us.
Yeah.
What we're seeing, though, is that there's also a serious level of criminality, because that's what it is. Let's call it what it is.
Yes.
It is criminality that is taking place in the country, and we have to, as a regulator, make sure that we address this.
As I've mentioned earlier, you've just launched the National Action Plan in collaboration with the National Department of Health and the World Health Organization. Can you perhaps outline its main objectives and what makes this plan a turning point in the fight against falsified medicines?
Thank you. So what makes it a turning point really is that it brings a range of stakeholders, including law enforcement stakeholders. So we've got a collaboration with the South African Police Services, with the Border Management Agency, with the Pharmacy Council, even with the NPA. So what this means is that the three core pillars of this strategy, which is that we need to collaborate as stakeholders to detect, that is, to identify these products. We need to collaborate to respond to these issues. and also we need to collaborate to prevent these issues. And those are the core elements. So what makes it different to what we've done in the past is that now there's a mechanism for a multi-stakeholder strategy to address these substandard and falsified products.
And how does this plan aim to strengthen coordination between the regulators, the law enforcement, customs, the private pharmaceutical sector, to sort of close the loopholes that allow fake products to enter the market?
So the benefit with a multi-stakeholder mechanism is that you can imagine if we have strong collaborations with the Border Management Agency, they will be able to block these products at the port of entry. When we then work with the police services, they will be able to, when we find individuals who have breached our laws, they will be able to prosecute those cases together with the NPA. So it says that along the value chain, we're strengthening our role, we're putting capacity, there's commitment from each of the stakeholders to put in place resources and capacity to address this.
As the chiefs mentioned that you're leveraging capacity along the value chain, it begs the question, what kind of monitoring or even tracing systems, or perhaps the digital or AI-based, are being piloted under this plan to sort of track the movement of medicines across the supply chain?
No, that's an excellent question. And we have to leverage digital technologies. We have to leverage AI. So we've just recently issued a guideline for a GSI tool, which is a barcoding tool, barcoding that will be on all the medicines.
Yep.
So with that, one would be able to scan it and check that it is indeed a bona fide medicine. But also for us as a regulator, we would be able to track the entire, the product along its value chain.
Now, Dr. Makokotlela, you've often warned that some fake medicines contain undeclared toxic substances or the wrong active ingredients. Could you perhaps share examples or the recent cases where these products caused harm or even fatalities amongst unsuspecting patients?
Yeah, so in South Africa, we don't have reports of fatalities yet. We know that, for example, I was making reference to, the cough syrup in the Gambia. Yeah. That had high levels of, material or elements that were toxic and led to the death of children. So what we do in South Africa, whenever we identify these products, we would send them to the respective labs that we work with, and they get tested. So the key thing is to ensure that we block them before they even enter the supply chain, because we do not want those toxic substance in them. The other point I need to note maybe for the public is that one channel that is causing us headaches is around this e-commerce channel, because what you're finding is that you have these platforms that are not licensed by us as a medicine regulator that are selling medicines. So you don't know where these medicines are coming from. You don't know the quality. They get delivered to you. So we want to urge the public, please, to be very cautious. And at the moment, there is no e-commerce platform that has been licensed by SAHPRA. So we urge you to please only buy medicines from a licensed pharmacy.
And which products or categories, such as antibiotics, chronic disease medication, or even lifestyle drugs, are most commonly targeted by the criminal networks or the counterfeiters, for lack of a better word, in South Africa?
Yeah, so what we're seeing is the over-the-counter medicines, so painkillers, cough medication, that certainly, so quite a lot of over-the-counter. But what we're also seeing is there's now, a trend of individuals using GLP-1s, who you may be very familiar with them, which are indicated for the treatment of diabetes. But one of the effects is that it leads to weight loss. And what we're seeing is that you're finding all manner of this product in the market, falsified, substandard, and even at times. So we really want to urge the public to say you need to ensure that you get, particularly these GLP-1s. We're seeing an increased trend because everyone wants to find a solution to lose weight. But please make sure that you get a prescription, and it has not even been indicated, at least for now. We will be quite soon registering it for the indication of weight loss. But we really urge the public, make sure that you do not get medication from facilities that are unlicensed.
And I wouldn't know whether it's vulnerability or it's desperation that leads us, not to take the proper safeguards when it comes to whatever drugs that is administered to us. Just how effective are SAHPRA's current inspection and laboratory testing capabilities in detecting falsified medicines before they reach the shelves or even the patients themselves?
Yeah, I mean, I must say, hence we've put this national action plan in place. Alone as SAHPRA, we will not be able to address this issue. We have seen, as I've said, an increase in these products, and hence we're working with a range of stakeholders. So while we are putting in place these mechanisms to detect, to effectively respond, and to prevent, it doesn't mean that we will fully curb this. We need to work with the stakeholders, and our intention is that we do get to a point where we have completely addressed this, and we need the public to report this to us so that we can send our inspectors to go to those facilities. Obviously, we do need to increase our capacity to be able to do all these inspections and seizures of these products, but this is a priority area for us as a regulator.
And I suppose it all boils down to capacity building, and beyond the regulatory and enforcement work, just how important is public education and awareness, in helping consumers identify and avoid the fake medicines, especially in rural or the informal markets?
Absolutely. Engagement with the public, creating awareness is a core element to this intervention. And we're grateful for media houses such as yourselves to invite us to such platforms where we can engage with the public. We will be having various webinars. We've also reached out to some of the community radio stations that we engage with them around this topic. So there is a big media campaign and a public awareness campaign that we will be embarking on.
And given South Africa's role as a major pharmaceutical hub on the continent, how do you see the country contributing to the broader conversation, to combat falsified medicines?
Yeah, and hence we raised our hand really to pilot this national action plan supported by the WHO, because we understand the role that we can play as a country and that we do have quite a sizable pharmaceutical market. And so the intention is that once we have then concluded this pilot, the findings from the pilot will be then shared with the broader African community and even just the broader community globally, so that they can learn from our experience. But also a core element to this is that it's not only for South Africa. We are collaborating, with our neighboring countries. And as I said, we'll be sharing learnings with the rest of the continent.
And finally, Dr. Makokotlela, what's your message to South Africans, in terms of vigilance, trust, and the shared responsibility we all have in ensuring safety and the integrity of the medicines that we consume?
Thank you. So, at the core of it really is that we all have the same interest, which is public safety. And so we want to urge the public that the minute they become aware of a product that is substandard, that is falsified, as I've described, please do alert us. We have a whistleblowing platform on our website that you can reach us through. Secondly, I would like to urge the public to stay away from e-commerce platforms for the procurement of medicines, because you do not know what you're receiving. You do not know where it's manufactured, and we have not regulated those e-commerce platforms at this point.
Dr. Makokotlela, great chatting to you. Thank you so much for sharing your time with us.
Thank you. Thanks.
Thank you. Well, that was SAHPRA Chief Executive Officer Dr. Boitumelo Semete-Makokotlela shedding light on the growing threat of fake and substandard medicines in South Africa's healthcare system.